Bismillah ar-Rahman ar-Rahim. This is Iman al-Sheikh and this is new lecture about the oral submucous fibrosis. Oral submucous fibrosis is recognized as a precancerous or pre-malignant disorder, and it causes inflammation and progressive fibrosis, which is characteristic sign, okay? And this fibrosis leading to pronounced stiffness and trismus. It's defined as a chronic disease affecting the oral mucosa as well as pharynx and upper two-thirds of esophagus. Clinical manifestation of oral submucous fibrosis, it's a chronic, okay, and the progression is slowly progressed. So the disorder depends on the disease stage at the time of the discovery. Most of the patients initially display a sensitivity to specific foods such as spicy food, as well as lip, tongue, and palate rigidity to varying degree, limiting mouth opening and tongue mobility limits, so it varies from patient to another. The hallmark of this illness is submucosal fibrosis. As we said, it's a hallmark or it's a characteristic sign which mostly affect the pharynx, upper third of esophagus, and oral cavity. Clinical feature, as it's a chronic, progressive, and it's irreversible disease, is very important to be noted. It's irreversible disease, okay? And some of these clinical features are starting by trismus or incapability of opening the mouth because of the oral fibrosis. Okay, and it's obvious, even in the picture, you can see. In addition to some clinical manifestations such as change of taste that may be caused by the more fibrous tissues in the oral cavity or epithelium, dryness of the mouth, earache, and loss of hearing due to stenosis of Eustachian tube. What is the cause, or what are the causes? Here you can say they are multifactorial. So various causes can be explained, such as excessive consumption of the red chilies, capsaicin, too much chewing of areca nut, deficiency of some nutrients such as vitamin A, immunological factors, poor immunity, or the immune response is poor to the body of the individual, genetically transmitted, and extensive tobacco usage, in addition to patients with deficiency of certain micronutrients. As you can see from the picture, the countries with the highest prevalence, they are East Asia, starting by India, Bangladesh, Sri Lanka, Pakistan, and others. And the Asian immigration to South and East Africa and also to the UK have been subject to several case serious reports. So those patients transmitted this habit and disease also to those countries. There has been information on large variance of oral submucous fibrosis prevalence among nations. As we said, some patients or some individuals transfer this habit. According to recent epidemiological data, the patients with oral submucous fibrosis increased from 200,000 to 2 million. Okay, so this is dramatically increased in India, of course. Why it's increased in India like this? The rapid spread of disease is due to availability of the areca nut preparation. They consider that areca nut is a primary etiological factor here for the disease. So availability, in addition to that, people from young age, the younger from teenager, okay, younger age patients acquiring this habit because of easy availability, successful pricing modification, and marketing initiatives. We cannot capsaicin in paper, lack of micronutrients such as iron and zinc, and lack of vital vitamins, all mentioned to be factors that can cause this condition. In addition to the autoimmune etiology, also genetic susceptibility of those patients. Okay, so some patients um, didn't using oregano or this habit, okay, they can be genetically susceptibility for this. Also, autoantibodies and human leukocytes antigen can presence and make some autoimmune etiology. Pathogenesis, starting by the areca nut, is the main etiological factor here. We want to know how this areca nut can make this to occur. First at all, areca nut contain alkaloid, arecoline, which is a primary etiological factor. This arecoline has a capacity to modulate matrix metalloproteinase, oxidase, collagenase, those enzymes, all affecting the metabolism of collagen. And in addition to prolonged alkaline pH induced by the arecoline, it will induce the death of the fetal fibroblast. Okay, fetal fibroblast type and replacement of those with a pro-fibrotic fibroblast, leading to increased fibrosis and resulting in decreased water retaining proteoglycan and increased type 1 of the collagen. Okay, collagen production type 1, it will be increased, and this will explain why there is a stiffness and limitation of the mouth opening. Tumor necrosis factor alpha also have been reported to promote the development of oral submucous fibrosis because it stimulates the fibroblast, thereby it's participating in the development of fibrosis. Other cytokines such as transforming growth factor beta and interferon gamma also participate in increasing production and of the collagen and decrease degradation of the collagen. So the collagen capacity will be increased. So this also will explain the stiffness. First clinical sign to appear is erythematous lesion in conjugation with petechia, pigmentation, and vesicles, okay, can be found. And then the oral mucosa become more pale or paler in appearance, and it will be looks like marbling or marble-like appearance, such as in this picture. And later on, a prominent clinical characteristic include fibrotic bands located beneath an atrophic epithelium. As you can see from the picture, it's obvious that the patient cannot open or there is a limit in the mouth opening. In addition to the pallor appearance, okay, and the patient may develop another symptoms such as dry mouth, which is obviously here you can see. Here the patient with a soft palate showing blanching and shrunken uvula, seen in the posterior part. And this patient is also developing a leukoplakia. So there is a classification for the oral submucous fibrosis grading from 1 to 5. Grade 1, there is a burning sensation, blanching, leathery mucosa, as we said, is starting by only sensitivity to spicy food, for example. And the mouth opening is more than 35 millimeter. Grade 2, moderate limitation of opening from 20 to 35 millimeter, and grade 3 there is a severe limitation less than 20 millimeter, and in a grade 4 we have A and B. A, the oral submucous fibrosis uh, will appear with the presence of pre-malignant disorders such as leukoplakia and erythroplakia. And in a grade 4B, oral submucous fibrosis will appear with epithelial dysplasia, any degree of the dysplasia. But in grade 5, the oral submucous fibrosis coexists with squamous cell carcinoma. The management, chronic and resistant nature of oral submucous fibrosis is widely established. So, oral submucous fibrosis is a pre-malignant condition. So, oral submucous fibrosis is irreversible lesion. Okay, the patient will not return to it, the nature of in the beginning before developing the oral submucous fibrosis. Okay, it's chronic, so it will develop in a slow manner, and the patient will come in a late stage. Okay, and we recognize this lesion as a pre-malignant or precancerous lesion, and the lesion has a potential to change into malignancy. So, our goal or aim of the management is to arrest the progression of the disease into malignancy. Okay? Symptomatic relief. And what are the different treatment options? Okay, first of all, please, in the first step, educate your patient about the negative consequences of the areca nut and related chewing products of the areca nuts also. And the patient must, as a first step, to stop or discontinue this habit. Okay. Second step is management approach consists of conservative, medical, and surgical management. Along with the medical and surgical management, physiotherapy is important. So, in the conservative treatment, first of all, restriction of the habit, nutritional or supportive therapy, oral physiotherapy. In addition to medical treatments such as lycopene, zinc, steroid, collagenase, interferon, aloe vera, and so on. Regarding the surgery, fibrotomy with graft, which is successful option, laser treatment, mononuclear stem cell therapy, and microwave diathermy. Regarding the nutritional and supportive therapy, micronutrient and minerals including iron, copper, calcium, zinc, magnesium, and selenium, as well as vitamins such as A, B, C, D, E, can significantly lower the level of the free radical. Also, dietary change in increasing the supplements of fruits and vegetables. Why? Because low fruit and vegetable consumption is associated with higher risk of developing precancerous and cancer lesions. So the patient must be supported with a good source of vitamins, nutrients, because they also will give a potent anti-inflammatory impact. In a conclusion, we have to know that oral submucous fibrosis is one of the pre-malignant conditions and important to be studied. Also, this is irreversible lesion. When you face the patient with this condition, we will only try to make a symptomatic treatment and prevent this progression into malignant. Okay, like a various controlling or treatment methods, corticosteroid, hyaluronidase, interferon, and microwave diathermy have been linked to ability to treat this illness, in addition to one of the surgical procedure which is good and beneficial. It's a fibrotic tissues and filling. Okay. In addition to some pharmacological combination can generate beneficial effects. You will find in the internet many publications and books about the oral submucous fibrosis that will light on its importance. Um, you can see oral submucous fibrosis management, oral submucous fibrosis reviews, a guide to diagnosis and management, okay, in addition to many publications. Okay, so in this lecture, we discussed the definition, classification, clinical feature, causative factors, pathogenesis, management of the oral submucous fibrosis. Thank you.